treat eczema in children?
Thank you very much. Good morning. It's my pleasure to be here. It's my first Apapari workshop in Ho Chi Minh, but before we had workshops in Hanoi, and these workshops in Hanoi were very good, very successful. So I hope we can do the same here. So I'm going to talk about eczema in children, which is a totally different subject. And I want you to go home without questions. And I mean, if you have a question, you should ask it. Yeah, don't be shy. We have translators if your English not 100%, so you can ask your question in Vietnamese. My Vietnamese very bad, but there are good people here to translate, so we should learn from each other. This is a day to learn and to go home and to be better and to be able to help the children better than we did before. So, I'm going to talk about eczema. And eczema is a terrible disease because it's about your looks, yeah? It's about how people judge you. And especially if you have eczema in your face, like this boy, he is afraid to go out because the people look at him and they think he is contagious and they avoid him. And in the school, their classmates, they make jokes of him. Yeah? So it's a terrible disease. It's about looks. It's about sleep. In the night you cannot sleep, you have itch. Yeah? And in the day, when you have to study, you fall asleep in the classroom. So actually, eczema is not a dangerous disease, but it has a huge effect on the quality of your life, and also the quality of the life of the whole family. Yeah? And eczema is very difficult to treat. And I'm sure you all have seen children with bad eczema and you don't know how to treat them. Now, eczema is not one disease. It's a syndrome. There are many types of eczema. There are genotypes, phenotypes, and endotypes. It's a bit complex, and that's why we call eczema a complex disease. So for instance, this boy has two types of eczema. He has allergic eczema, mainly around his eyes, and this is caused by house dust mite. But he has also very bad eczema here, around his mouth, and this is contact dermatitis to his own saliva. So children with eczema have a very sensitive skin, and they can have various types of eczema at the same time. This child, for instance, has a normal skin in between, but he has very bad patches of infected eczema. And this is because in this child, the cause of the eczema is an abnormality of the immune system in the skin. So you have different types of eczema and you have different mechanisms. And actually, to make it a bit more simple, we distinguish 4 types of eczema in children. There's atopic dermatitis, and that means eczema in which allergy is involved. And I'm not saying that allergy is the cause. Usually allergy is the consequence. It starts with eczema, then they develop allergy, and then the allergy will make the eczema worse. So the second type is contact dermatitis, and you see it often in children around the mouth. And this is usually not due to food allergy. Sometimes the parents think it's food allergy, but most of the time it's due to allergy to saliva. More kind of irritation. Then we have seborrheic dermatitis, which is a dermatitis of the very young children. It's a very mysterious type of dermatitis, and we don't know exactly the causes. All we know is if a young baby has seborrheic dermatitis, 50% go into allergic dermatitis. So if you have a young child, a newborn with cradle cap and seborrheic dermatitis, the risk that he will develop atopic dermatitis is 50%. And then the fourth type is constitutional eczema. And that's a type of eczema in which allergy is not involved. So you see, you have four types of eczema. They can coexist in one child, and they can also go from one in another. And a typical evolution of eczema in one child is this. They are born with a dry skin, because no child is born with eczema. No baby has eczema at birth. Maximum at birth they have a dry skin. And then they develop constitutional eczema. And then allergy comes in, and then we call it atopic eczema. And then they develop contact dermatitis. So this is actually in time the progression of eczema in children. But there are many, many subtypes. And this picture is a very beautiful but decent naked lady. And I show you this picture to remind you that children with eczema are living with a naked immune system. And I mean a naked immune system is that their skin barrier doesn't work. We all have a good skin barrier to protect us against the environment. But children with eczema, usually most of them are born with a thick skin, and there are holes in the skin. So actually their immune system is not protected. They live with a naked immune system. Means the immune system is in direct contact with the environment. And that's why, because they have no protection, no barrier, that's why they develop very easily allergy. And in eczema, allergy is very special. It's not like in asthma or in hay fever or in food allergy. Eczema is an allergy that occurs through the skin. And that's why they can be allergic to so many things that are airborne. And even food is airborne. So, because every time you smell food, you smell peanut or you smell fish, means it's in the air. And that's why children with eczema, they can have many food allergy without eating or without drinking the food. Just walking in a room with a lot of food in the air can cause a flare-up of eczema. And in Singapore, we see a lot of children with eczema and they walk through a food court, a kopitiam they call it, I don't know how you call it here, a food court, and they do a flare-up of eczema. And this is because of the direct contact of the immune system with food through the skin. So actually in eczema, the skin is the reason of the allergy. Yeah? And in Singapore, eczema is very common. I saw one slide from Vietnam, from Professor Wan, and it looks lower here. Prevalence looks lower here. I have no idea, but in Singapore, this is a study we did a few years ago. it's about 20-25%. So let's say 1 in 5 children, and I'm talking about young children, these are young children, these are infants. 1 in 5 children have eczema. So in Singapore, it's the most common skin problem in children, mainly in young children, but many grow out of it. When you have eczema, it's not for the rest of your life. And we don't know why they grow out of it. We don't know the mechanisms. We don't know why children with an allergy, and I'm not only talking about eczema, but also asthma or rhinitis or food allergy, some grow out